Hi there, my name is Sarah Blackmore and I'm a registered clinical counselor. I'm really excited to be sharing the Navigating Your Mental Health Compass video series. This episode, Discovering Your Mental Health Compass, is the first of an 8-part video series that provides evidence-based information to help you build greater self-awareness, learn effective strategies to better your mental health, and move beyond obstacles to live a life with meaning and purpose. I live and work in Vancouver, BC, on the traditional unceded and ancestral territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh nations. My professional background includes a master's degree in counseling psychology and over a decade of experience in a variety of sectors, including education, health, nonprofit, and private practice. I have postgraduate training in various evidence-based therapeutic modalities, which have allowed me to support people through individual and group work. I now focus on supporting individuals in my private practice, North Talk, here in Vancouver, where I offer both in-person and virtual counseling services for the general public, as well as clinical consultation and supervision for counselors. I'm passionate about supporting and fostering mental health and wellness from an approach that recognizes the innate strengths we all have while creating opportunities to build greater self-awareness, develop effective coping strategies, and live a life with purpose and fulfillment. Outside of my professional role as a counselor, I'm a mother, a partner, daughter, sister, auntie, friend, and community member. I was drawn to counseling at a young age when I was lucky enough to experience being a client and receive invaluable support myself. I know that not everyone has the means to access individual counseling, which is why I'm passionate about making mental health support accessible through different means, such as this video series. Although the Navigating Your Mental Health Compass video series will be focusing on how you as an individual can increase your self-awareness, engage in effective coping strategies, and connect to what's most important to you, I want to emphasize that we are all impacted by our individual experiences of both power and oppression, and that our mental health is impacted by larger systems of oppression, including systems of patriarchy, colonialism, heteronormativity, racism, and more. I think it's imperative to name these systems of oppression so as not to further perpetuate the idea that our struggles are only a result of what's in our control. The reality is we need to name and be aware of harmful systems so as not to internalize and blame ourselves. This video series, Navigating Your Mental Health Compass, focuses on what is in our control and the things we can do as individuals to better our mental health. But we also have to remember that we don't exist in vacuums, and we are all impacted by the problematic systems around us that also require change. Paying attention to what's within our control can help empower us to make positive changes in our lives. However, there are often no quick fixes to enhancing our mental wellness. Oftentimes, we know what we should and shouldn't be doing, but it's difficult to break out of patterns, especially if those patterns were once helpful. For example, perhaps you are someone who constantly engages in worst-case scenario thinking, also known as catastrophic thinking, so that you can help yourself feel prepared. Maybe you engage in this type of thinking purposefully, or maybe it's just something that happens without much intentional thought. This type of thinking is completely normal for humans to do, as we are wired to be prepared and keep ourselves safe. However, what can be sometimes helpful and adaptive can cross over to unhelpful and harmful when this type of thinking takes up a lot of our time, prevents us from doing the things we care about, or leads to heightened stress and overwhelm on a regular basis. It can also be difficult to break out of patterns when we don't know an alternative. Let's say, for example, you are someone who experiences low mood or mild to moderate depression. You may be used to having such thoughts as, "There's no point, I don't feel like doing this," or "I'll wait until I have more energy." These are very common types of thoughts associated with low mood and depression, and you may be used to experiencing these thoughts, believing them, and making decisions to do or not do things as a result of them. You may not be familiar with different ways in which you can interact with these thoughts that may help you better cope with low mood and potentially lessen your depressive symptoms. So, one of the things I will be doing in this video series is offering alternative coping strategies that you may want to try and can then determine for yourself whether or not they are helpful in shifting your mood, shifting your relationship with your thoughts, and or increasing your ability to cope with life's challenges. This video series will provide general mental health information and strategies that won't necessarily be individually tailored to your experience. So, I invite you to be participatory in this process and take into account your own wisdom, circumstances, and lived experience. With that said, I encourage you to be open and curious and willing to try some new things out, as the approaches I will be covering are backed by years of extensive research and evidence that has been shown to be generalizable. So, let's dive in deeper on what this video series will be offering you. This 8-part video series, Navigating Your Mental Health Compass, will provide ways of understanding yourself better, as well as concrete tools to help you cope with challenges and improve your overall mental health. Navigating Your Mental Health Compass is rooted in acceptance and commitment therapy, also known as ACT, which is an empirically based psychotherapy developed in the late 20th century. There are 6 core processes in ACT that provide psychological coping strategies as well as behavior-based strategies to help individuals improve mental wellness and connect to a sense of purpose and fulfillment in life. These 6 core processes are contacting the present moment, acceptance, diffusion, the observing self, commitment, and values. ACT is designed to help individuals improve their mental well-being by promoting psychological flexibility, which is the ability to adapt to various situations, change behaviors, and pursue values-based actions, even in the presence of challenging thoughts and emotions. So let's break that down a bit. In ACT, psychological flexibility is the main goal. This means that we're able to adapt to our circumstances, and instead of engaging in behaviors out of habit or responding in ways that are driven by, let's say, anxiety, low self-worth, trauma responses, low mood, or other mental health challenges, we are able to respond and behave in a way that serves us best in this situation. Psychological flexibility also means engaging in behaviors or actions that are aligned with our values. This is a big part of ACT. Values refer to the deeply held, personally meaningful qualities and principles that guide our actions and choices in life. They represent what you want to stand for and what you consider to be most important and fulfilling. So, psychological flexibility is having the mental skills to accept your emotions, not be controlled by your thoughts, stay in the present moment, know your values, and take meaningful actions in line with those values, which helps you lead a richer and more fulfilling life, even when faced with challenges. One of the things that I personally love the most about ACT is that it's less focused on symptom reduction and more focused on helping individuals live meaningful lives. This means that you don't necessarily have to get rid of your anxiety or depression, or have no trauma history, or only have high self-confidence to have improved mental health. From an ACT perspective, you can use tools and strategies to help you manage these difficulties while doing things that are important to you and give you a sense of meaning and purpose. One of the metaphors often used in ACT is that of a compass, hence the name of this video series, Navigating Your Mental Health Compass. The compass is a visual representation that illustrates how your values can serve as a guiding compass in your life. In the ACT compass, your values are like the North Star. They represent your true direction in life, your guiding principles, and what matters most to you. Just as the North Star has been used to assist in navigation, your values provide you with direction and purpose. The compass needle represents being present in the moment. In ACT, mindfulness and present moment awareness are crucial. The needle reminds you to stay focused on the here and now, as that's where you can make choices and take actions that align with your values. The other compass directions, east, west, south, represent the various thoughts, emotions, and challenges that may pull you away from your true north. Just as we must navigate around obstacles when we are going somewhere, you must navigate around difficult thoughts and emotions that might try to steer you off course. The compass pathway symbolizes the actions you take in your life. These actions should be in line with your values, moving you closer to your North Star. The goal is to commit to actions that honor your values even when faced with obstacles. Just as a compass needle adjusts to changes in direction, psychological flexibility means being open and adaptable to life's twists and turns. It's about staying true to your values, but also recognizing that sometimes you need to adjust your course based on the circumstances. The ACT compass metaphor illustrates that life is a journey, and your values are your guiding principles. While challenges and difficult thoughts and emotions may arise along the way, your commitment to taking actions in line with your values keeps you on course, much like using the North Star to help you navigate. So in this video series, I will guide you through enacting coping strategies to help you navigate difficult thoughts and emotions, discovering and connecting to your own personal values, taking action steps in alignment with your values, and in so doing, being flexible in adjusting to your changing needs and circumstances. What will this look like? Each of the next 6 videos in this series will focus on one of the 6 core principles in acceptance and commitment therapy, and the final video will bring all of the core principles together and outline how you can go between the principles to move towards the ultimate goal, psychological flexibility. Here is a brief summary of what's to come in this video series. In the next episode, episode 2, I will cover present moment awareness. ACT emphasizes being fully present in the moment and engaging in mindfulness techniques to connect with the here and now. In episode 3, I will review the namesake of ACT, acceptance, which refers to acknowledging and embracing your thoughts, emotions, and bodily sensations without judgment. It's about making room for uncomfortable feelings rather than avoiding or struggling against them. Episode 4 will focus on the concept of cognitive diffusion, which involves learning to detach from your thoughts and see them as mere mental events rather than absolute truths. This detaching helps reduce the impact of negative or unhelpful thoughts without getting caught up in the often unworkable strategy of changing negative thoughts into positive ones. In episode 5, I will go over the ACT concept of the observing self. This involves recognizing that you are not defined solely by your thoughts, emotions, or experiences. Instead, you have a stable and observing part of you that can observe and accept these aspects of your inner world. This concept can be a bit tricky, but we'll bring it to life with metaphors and visuals. Episode 6 will dive into one of my favorite aspects of acceptance and commitment therapy, values. I will help you identify your core values and what truly matters to you, which is crucial for setting meaningful goals and making choices that align with those values. In episode 7, I will review the ACT concept of committed action. Once values are clarified, ACT encourages individuals to take committed action towards their chosen life values, even in the presence of difficult thoughts and emotions. And finally, in episode 8, the final episode in the Navigating Your Mental Health Compass video series, I will bring together the 6 core processes of ACT and discuss how you can go about implementing these processes to better your mental health. ACT has been used to treat a wide range of mental health issues, including anxiety, depression, substance use, chronic pain, and more. It is often used in therapeutic settings, but my goal with this series is to bring the concepts to the public in an accessible format. It's important to note that ACT is one of many therapeutic approaches, and its effectiveness can vary depending on the individual and their specific needs. This video series is not meant to replace individual or group therapy, but rather provide accessible information and strategies that can be used in combination with other supports to help increase your mental health. Please be sure to reach out and connect to friends, family, and/or formal mental health support if needed. If you've made it this far in this first episode, congratulations. Thank you for joining me in the Navigating Your Mental Health Compass series. This video was an introduction of what's to come in this video series, and it included a brief overview of acceptance and commitment therapy and the metaphor that this series is based on, the compass. I look forward to helping you develop your own North Star and connecting you to where you want to go while offering supportive strategies to help you navigate obstacles and difficulties. Up next is episode 2, the present moment, one of ACT's core processes and strategies for those who are struggling with their mental health. Once again, I'm Sarah, and thanks so much for joining me in the first episode, Discovering Your Mental Health Compass. Please be sure to check out all the videos a part of the Navigating Your Mental Health Compass series on YouTube.